Here we go. We have Dr. LoVecchio with us now. Our first question for you this morning, doctor, comes from Lori. She asks, my husband and I got our first shot. We had no side effects. Should we expect anything from the second shot?
Great question, and maybe. The people who got the second shot reported side effects 37% of the time. Most of them were arm pain, some soreness, but some did report full body ache and fever. The good news is about 3% of the time they called in sick for work the next day. Granted, many of these patients who got it initially were healthcare providers. So about 1 in 3 people report something.
So our second viewer question this half hour is asking, what about people who can't get a second vaccine appointment? We are hearing that this is happening here in the Valley. At what point do you start to panic, Dr. LoVecchio?
Well, Maricopa.gov, if you Google Maricopa.gov and vaccine and second shot, there are places you can kind of write and say, hey, I never got my email for the second appointment. And I think the time to kind of be a little bit more concerned is about 10 days before. I guess they're supposed to email you your second appointment if you didn't get it that day. And some people maybe put their email in wrong, but more likely they are overworked and burdensome. So I think you should write them about 10 days out. Again, there is a site. A lot of people have this complaint. Go on the website, maricopa.gov, look for vaccines, second appointment, and you'll see a form that you have to fill out.
All right, so our third question, it probably doesn't apply to everyone, but this is very interesting. I contracted COVID a day or two before my first Pfizer shot. I've had my second shot, and I'm wondering if the shots will help cure me of COVID, or does it have to run its course?
From the time you get your second shot, even that first day, your antibody levels are where you're going to be. Your protection is well over 80% or so. And by 2 weeks after the second shot, you're at 95% or so where you want to be, antibody-wise. You do start to develop some antibodies a couple days after your first shot, but probably not enough to protect you. They say after the first shot, on average, you get about 50% protection. So probably a little bit of both. If you got the COVID-19 2 weeks after the second shot, I'd say you're probably going to have a very, very mild disease. Almost definitely you're not going to die. Okay, but if you got it, a week or two after the first shot, it's probably going to blunt it, but not as much as after the second.
Interesting, though, with this particular question, this person got their shot while they had COVID. And I'm wondering if that's a good idea. I mean, we're telling people to get the shot whenever they can because it's hard to get the appointment. But would it even be effective if you currently have COVID?
The thought is that you're going to develop antibodies on your own to COVID-19. But also the vaccine is kind of move things along for you to develop it. So the short answer is yes, it would help. And it's all going to be about the timing about it.
Interesting. All right. Dr. LoVecchio, thank you so much. Stick around with us. He's going to be with us through 7 this morning. You can continue to send in questions, 602-444-1212. We're going to get to as many of these questions as we can this morning.